Okay, it looks like we've got a good group that's joined us so far. And we'll get started with this really important forum. Welcome, my name is Claire Berkowitz. I'm the president and CEO of Mid-Coast Maine Community Action. We're located in Bath, but serve the Mid-Coast region from Brunswick all the way up into Waldo County with some of our programs. I'm also a proud member of the Maine Community Action Partnership Board, and they're one of the sponsors of this important event tonight. Our other sponsors are Healthy Androscoggin, Maine chapter of the American Academy of Pediatrics, Healthy Acadia, Maine Public Health Association, US PIRG Education Fund, and Helping Hands. We're really grateful for the sponsorship of this important event, and thank you all for the work that's been going on behind the scenes to make this event happen, especially Madeline Desfossés with US PIRG. And I think we'd like to also thank those across the state who helped to promote this forum, including these organizations that you see on the screen. It really helps to have people spreading the word through social media and their email networks and whatever other way you share information in this time. So thank you. So tonight, I'm coming to you from an elementary school in Bath, and I thought this would be a good location to and an appropriate backdrop to moderate this forum about getting our children ages 5 through 11 COVID-19 vaccines. There's a PTA meeting going on in this building, and there are children in the gym masked and socially distanced watching a movie while their parents talk about their school. And so that's why we're all here tonight, to talk about the vaccines that last week, I believe it was last week, COVID times, things seem to have a different timeline than normal times. The CDC has recently recommended that 5 to 11-year-old children receive the COVID-19 vaccine, offering a way for parents to protect their children and families from COVID-19 infection. And so tonight's forum is a chance for Maine parents to hear from experts on this topic, pediatricians. And so they're going to share information with us and help us in these decisions to vaccinate children against COVID-19. And just so you know, the forum timeline will look like this. We're going to have some opening remarks and introductions of our panelists. We're going to then turn towards some pre-submitted questions that those of you who registered submitted, and then we're going to take at the end live questions. And I see that questions are coming in already from folks who are registered and on this forum. So we will be giving you an opportunity to get those questions answered. So our panelists tonight are Dr. Gretchen Pianka. She's a pediatrician at Central Maine Pediatrics. Dr. Jillian Gregory, pediatric critical care physician at Maine Medical Center. Dr. Sydney Seawall, a pediatrician at Maine General Health. And Dr. Michael Ross. He's a pediatrician at Northern Light Pediatric Primary Care. So we're going to start this off with our esteemed panelists by just opening it up with a kind of a broad question for you to respond to, or to just share your thoughts on. What is the most important thing for parents to consider when making the decision to vaccinate their child? And Dr. Pianka, I'll start with you.
Okay, thank you so much. I'm honored to be here, and really excited about this opportunity to talk about the vaccination. In my role, I help families make decisions about what is right for their little ones every day. With regards to healthcare decisions, I often kind of jokingly think of myself as sort of a fancy waitress. So it's my job to really understand the menu and then show you what the options are. And then it's also my job to help explain the risks and benefits of each choice. So over the last 20 months, I have just seen children's lives completely turned upside down by COVID, their ability to have play dates and activities and see relatives and go to school even. So really basic things that we want for our kids have not been able to happen. So, this is exciting for us as pediatricians to have something to offer. I think inherently going back to the original question. So the most important thing to me for families to think about when they're making this decision is to understand what space they're coming from. So as parents, we make a lot of decisions about complicated things for our kids, and a lot of times we feel afraid. And when we're coming from that space of fear, sometimes it's hard to think clearly, it's hard to rationalize, it's hard to take in all the appropriate information and make the decision that's right for your child. But I just want to say, as parents, you guys know how to do this. So you've already figured this out. You figured it out when your little tiny toddler wanted to go ice skating and you were terrified they were going to hurt themselves, when your teenager wanted to play football, or when somebody's going off to driver's ed, and you know how to work with that fear, and you know how to metabolize it, and you know how to take in information and then make the decision that's right for your family. So we're here to help you understand the menu and make a decision that's right for your family.
Thank you. I really appreciate the way you framed that, and as a parent myself of now young adults, it's just thinking about all of those things that we go through as parents to get our kids kind of through all of those milestones that you mentioned. It's a really good way to frame it for those who are thinking about this. Dr. Gregory, I'd like to hear your response to that open-ended question.
Sure, absolutely. Thanks for having me. I hope I can provide maybe a little bit of a different look into this as well, because I'm a pediatric critical care doctor at Barbara Bush Children's Hospital and Maine Medical Center. So I work in the ICU and I take care of kids that are very sick and need ICU level care. And, for me, thousands of kids in this age group, age 5 to 11, have needed to be hospitalized for COVID since the beginning of the pandemic. And many of these kids have needed ICU level care as well. And so I think that kids are often thought of to be low risk for severe COVID. And that's very true, but low risk really does not mean no risk. And I think it's an important thing to know. I've taken care of kids who have had both COVID pneumonia, and I've also had something called MIS-C, which I think we could probably talk about a little bit later in the hour as well. And these kids have needed breathing tubes and ventilators. They needed blood pressure medicine to fight off this disease. And in regards to MIS-C, so this is the multi-system inflammatory syndrome that we see in children. That can be an overwhelming inflammation in the body that can happen after a COVID infection. This is predominantly seen in this age group of ages 5 to 11, and these kids are usually otherwise healthy. So based on all the evidence we have about this disease and about the vaccine, and how we know that getting vaccinated is the best protection to keep people out of the hospital, while kids may be low risk, they're certainly not no risk when it comes to this virus, which can be rather unpredictable. And so I think parents should strongly consider this when they decide whether or not to vaccinate their children.
Thank you. That's an important perspective, because I don't think it gets enough attention in the news media about kids who are hospitalized. You see it sometimes, but it's just not as focused upon. And so understanding that risk is really important. Dr. Sewell, I'd love to hear what you have to say from your perspective as a pediatrician and what you're seeing for children and why this vaccine is important.
Sure. I'm Dr. Sewell. I'm a pediatrician. I've been practicing in the Augusta and Water Valley area since the early 80s. As you can see, I'm a little older than the rest of my peers in this forum. And I've never seen anything like this, how our normal walk of life has been disrupted so much by any event, and especially an infection. So what I'm hoping, and I think is very possible if we can get a population highly vaccinated, is that we can take one more step closer to being more normal. Intergenerational relationships have been disrupted. I'm a grandparent. For over a year, I could not see my grandchildren. And it's still very difficult because some of them live in Canada. And school closures. I mean, one of the things that we really have regretted over this last year is the fact that our kids' lives were so incredibly altered by this virus. And I think parents should recognize that having their kids immunized both will normalize their existence and also help contribute to a normalization of our society.
That's a really important point too. I mean, this week we saw schools in different communities are closed because of COVID. And so that it is still disrupting children's lives, maybe not statewide, but within a community. And for that community, it's a really important piece of the puzzle in terms of getting back to that normalcy and having kids in school and allowing parents not to miss work. It all goes together. So I appreciate that. And Dr. Ross, I'd love to hear what you have to say and your experience through all this pandemic.
Sure. Hi, good evening. My name is Mike Ross. I'm a pediatrician and a medical informatics officer. I do EMR work in addition to general pediatrics up at Northern Light. I would speak from two perspectives. One, kind of tipping hat in terms of what Dr. Sewell has already said about a return to normalcy, but really focusing upon a return to normalcy associated with different activities for kids. We know that kids, when they get COVID, that they can have a risk of some cardiac complications, the biggest one being that MIS-C that was mentioned earlier. But we also know that there is some more low-level inflammation that can occur. And there's a return to sports protocol that is required in terms of evaluating somebody after they've had COVID to determine if they're safe to go back to sports. That has led to challenges with kids participating in sports as young as 5, and continues to be a real barrier to getting back to that sense of normalcy that we all are looking for so dearly. The other thing that I want to speak to is thinking about others within our homes, whether that is an elderly grandparent or an immunocompromised parent. Children, we all know that when we send our children off to preschool and send them off to school, that they come home sick. And part of that is normal development of the immune system. But part of that, especially if it's COVID, is something that's not so normal. And this is that best layer of defense is forming a shield around our population by as high levels of vaccination as possible.
Thank you all. I think you really, just those opening remarks really made me think about some things, that I hadn't even thought about as throughout this time as the vaccine became available to children in the last couple of weeks. You've given me some new information to think about. I'm going to turn to some of our questions that we received from our registered attendees. And the first question is for Dr. Gregory. What is the current data on long-term effects of the vaccine on children? And how does this compare to the risk and long-term effects of possible COVID-19 infection in a child?
So that's a great question. I don't think I have a short answer, but I'll try to give you my perspective here. So here's what we know if a child gets COVID. First of all, we know that thousands of kids in this age group, 5 to 11, have needed to be hospitalized. We know that MIS-C can occur in a child in this age group, and it occurs in usually healthy children without underlying conditions. We know that unfortunately some kids have died from COVID. It is currently the 8th leading cause of childhood death, and over the surge with the Delta variant in the summer, it was the 6th leading cause of death for children in this age group. We know that there are long-term effects of being hospitalized on kids, both physically and mentally. They miss school, they miss their friends, they miss their sports. It's super stressful for them. It's super stressful for their families, any kind of hospitalization. And then other long-term effects of COVID in children, there are definitely reports of kids with long COVID or long haul COVID, as it's been described, where for weeks or months after they are infected. They have fatigue, they have headaches, they report trouble concentrating, they report trouble sleeping, they can have respiratory or breathing, coughing issues. And these symptoms can also affect kids' ability to go to school and their quality of life. And so the long-term side effects of COVID compared to the concern for long-term side effects of the vaccine, I think it might be helpful to maybe know about the Pfizer study and kind of understand why we're recommending vaccination for children. So over 3,000 patients in this study were given this lower dose of the Pfizer vaccine. Everyone was monitored for side effects at least 2 months after the second dose. And I think this is really important because we know based on decades of vaccinations, and I think pediatricians are really the docs to talk to about vaccines because we give so many and we have for so long. And so any side effects that occur usually occur within the first 2 months. And that's because vaccines don't hang out in your body and accumulate the way that, let's say, a medication would that you take daily for months or for years. They get in, they get out, they degrade rather rapidly. So during the study, there were no safety concerns identified, and these studies are ongoing and the side effects are monitored very closely. So for me, when you compare the risks of a COVID infection to the risk of a vaccine from a long-term perspective, the risks of the vaccine really seem to be far less.
The follow-up question that someone submitted was, most healthy children don't get seriously ill from COVID-19, so why get my child vaccinated? I mean, I think you might have spoken to that, but that can still, a healthy child can have serious response.
They can, they absolutely can. And, you know, from all the data that we have on all the hospitalizations for children in this age group, healthy children have gotten infected, healthy children have been hospitalized and have died with this. And so I do think that it is worth the vaccination in this age group.
Thank you. I'm going to move to the next question, and this is for Dr. Pianka. Do we know the long-term effects that this might have on children's development, including their fertility and reproductive health? And I'm assuming they meant that this meant the vaccine, but it could be COVID too, right?
That's a good point. I'll follow on what Dr. Gregory said, is that this vaccine, so if they're referring to this, the vaccine, the Pfizer vaccine, which is an mRNA vaccine, simply the way I tell it to families and to kids is it's like you're kind of mailing a letter to your cells, and the messenger RNA in the vaccine gives your cells a message, and that message is to make an antibody so you're going to be protected when you see the COVID virus. And that's all it does. The messenger RNA is torn up, letters torn up, thrown away. It's not there anymore. There's nothing that's left in your body. There's nothing that stays there except that immune memory, which will make your child stronger from the inside out and ready to face that virus if they see it.
That was the best description I've ever heard of the mRNA vaccine in all of this time. So that was a really clear visual for me. And I hope for all the parents listening about what it's doing and how it works. Dr. Ross, I'd like to ask you, or to please explain how these COVID-19 vaccines were developed so quickly, when in the past vaccine development often took years to develop.
Yeah, it's a great question. And a lot of it comes down to both the amount of resources that were spent on this vaccine development, as well as the nature of a coronavirus. Coronavirus is part of a family, and we've known about coronaviruses, we being scientists and doctors, for the last 50 years. And so we've known about some of the virility associated with that, what causes coronaviruses to be dangerous. Now, COVID-19 is a whole other level associated with that. And a lot of that is associated with what's called the spike protein, which is the way that the virus is able to be so infectious. Being able to target that based on previously understood knowledge, previously understood experience with coronaviruses has been key. The other thing that's real important to remember is, and to understand is how much incredible worldwide resources were placed into the development of this vaccine and all of these vaccines, to the point where they were stockpiling of vaccines that were just not used, because almost to the point where things were created and stockpiled and then tested. And if those tests did not work out, then that was not something that was continued. But Operation Warp Speed really brought together a huge amount of resources to be able to develop this content quickly. The last thing I think that's important to remember is some of the reduction in financial pressures, because world governments and Operation Warp Speed were supporting development of this. Typically, you have phase 1, phase 2, phase 3. And those different phases are associated with both safety as well as effectiveness of the vaccine. Imagine instead of them being 1, 2, 3, they are 1, 2, 3, where you have them actually happening at the same time. That's pretty unheard of and not been done up till this pandemic. But you're able to shorten your time considerably in terms of being able to understand both the safety of the vaccine as well as how effective it is.
Thank you. Dr. Sewell, I'd love to ask you, could you explain any reasons why a child shouldn't be vaccinated for COVID-19? And what kinds of things elevate vaccination risks for certain children?
The contraindications of this vaccine are really quite rare. If you've had a significant reaction to a previous dose, that would be one contraindication. The other ones would be if you are known to have a significant allergy to one of the components of this vaccine, which again are all very unusual. It would be very unusual to present with. And then there's some kind of relative contraindications that aren't necessarily ruling out your possibility of getting the vaccine. But if you yourself have had like Guillain-Barré, which again doesn't occur very often in this particular age range, you should have the literature says at least you should have a discussion with your primary care doctor, and it would depend on the rate of prevalence in the community whether it would be worth it or not for you as a parent to have your child vaccinated. But that kind of event generally does not occur with a different stimulus than the original stimulus, which was probably some other virus. So those are the ones that are listed, all incredibly unusual. Now, the reason to get your child vaccinated often would be to prevent your child from giving COVID to somebody who's had those same kind of issues, because certainly Guillain-Barré from the vaccine is much less common than Guillain-Barré from COVID itself. So if you have a relative that's had Guillain-Barré, you probably should get your kid vaccinated to protect that person from getting exposed to this other virus.
Thank you. The next question is kind of open to anybody on the panel. Someone wanted to know, do any of you have children ages 5 to 11 in this age group? And if so, are you getting them vaccinated?
Grandchildren, yes.
And yes, my 11-year-old son just got vaccinated at 6 o'clock tonight. He was a little bit anxious, but I had him chew gum and listen to music, and he was really excited about it.
Oh, great. Anyone else have young children in their lives?
I don't. I'm not quite at Sid's level, but I have a 17 and a 21-year-old. But they've been my biggest teachers, and I never recommend anything that I wouldn't recommend for them. I think that we could all say that pretty comfortably.
Great. Dr. Gregory, are there benefits to waiting until the Moderna and J&J vaccine are done with their trial phases among younger children before having their child vaccinated?
Well, my short answer is no, I don't think there are benefits for waiting. And just to explain that a little bit more. So, I really think the quicker that kids can get vaccinated, the safer and healthier they're going to be, and the safer and healthier their friends and their families are, especially with the holiday seasons approaching, because the less they'll be infected and the less they'll spread COVID potentially. So the vaccine's very effective, and we know that J&J or the Johnson & Johnson and the Moderna vaccine have are undergoing certain trials, but we don't know when that data will be available yet. And so given how safe the Pfizer vaccine is and the research we currently have, I don't see a reason to wait for the other vaccine trials to be finished.
Thank you. Dr. Sewell, do children need 2 shots of the vaccine, and what is the dosage of each shot like?
So the Pfizer vaccine, when it was trialed for this age range, before they gave it to 3,000 children, they had to figure out what dose would work best. And so they started off with the regular adult dose that the teenagers also get, the 0.3 milliliters, which is about a 20th of a teaspoon, maybe. So what they found was that it was very effective, but it had a lot of side effects at that dose. Not serious side effects, but the arms got really sore, and a lot of the kids had fever. So they cut back the dose, and they found that with the 0.1 milliliter dose, which is what is now being given, you had just as good of an antibody response and minimal side effects. Somewhere between 5 and 10% of the kids get enough of a fever that they do want to take Tylenol or ibuprofen, and a smaller percentage, maybe 1 or 2%, have fevers enough that they stay home from school. They can't do their usual activities. But beyond that, there were no significant reactions at this dose. And in fact, what they found was that kids at this age level were less reactive to the vaccine than the teenagers or the young adults who had higher reports of sore arms and fever after getting these doses. And their antibody response actually was as good or better than the teenagers and young adults, even at this low dose. So yes, you do get a repeat shot, just like the adults do, and just like the teenagers do, but you're getting a third the dose, and it seems to work just as well.
There's a follow-up question about this. Somebody asking why is it that my 12-year-old gets the same dosage as an adult, but then somebody who's 10 months younger would get that lower dose. I was thinking about my own children because I have very tall young women in my life and they've always been tall and they've always, so how is it done by age versus?
Your immunologic maturity is more based on age than how big you are. Certainly, they have to draw a line somewhere. And certainly if a 11-year-old got the 0.3 dose, they might have a sore arm, but nobody's going to be that upset by it except the doctor that gave it because they made an error. Likewise, if somebody who's 12 and a half got the 0.1 dose, at least the CDC recommendations now is they don't have to repeat it because they're probably going to respond just as well.
Okay, thank you. Dr. Pianka, if your child has had COVID, is there a waiting period then to get the vaccine?
So you definitely want to wait till you're done with quarantine. And then the other thing that's really important is just to wait until your child's back to their normal baseline level of health. I'm a big believer in letting the immune system kind of do one thing at a time. So make sure they feel better, they've been better for a little bit, and then get them vaccinated. The only other thing that would slow down vaccination would be if for some reason a child had gotten the monoclonal antibodies, and those you have to wait 90 days, but that's pretty uncommon and only usually the older kids. So I think in this age range, it wouldn't be relevant.
Thank you. Dr. Ross, how are the side effects of the COVID-19 vaccine similar or different to those of other vaccines that children commonly receive?
Sure, they're pretty similar overall. They seem to be, your typical discomfort at the injection site, fatigue, headache, chills. There could be fever, some joint pain, but overall, they seem to be in line with vaccines for other vaccine preventable illnesses. They may be a little bit more significant. It's unusual for kids to miss a day of school after a vaccine, and we do see that sometimes with teens, and we expect to see it sometimes with 5 to 12-year-olds. That being said, though, the degree of discomfort that we're talking about is extremely variable. So someone might have absolutely no side effects. Someone might have more significant side effects. We also know confidently that the degree of side effects that you have has no bearing upon your immune response. So if you have really significant soreness and achiness, that doesn't mean that you are super protected from COVID. It just means that that's how your body processed that shot. Conversely, if you had no reaction, that doesn't mean that you're at any higher risk or lower risk. It's just, again, how your body chemistry responds.
It's good to know. My husband and I both just got our boosters, and I had no reaction, and he was, he felt more achy than I did for a day, but recovered very quickly. Dr. Pianka, have studies been done with respect to the effect of the vaccine on children with autism? And should youth that are on the autism spectrum get vaccinated?
So I'm glad this was a question that I got ahead of time, because that gave me time to do my research so I can really do the whole menu thing, because I had not seen it, but actually people have. So I found a study that looked at people with a diagnosis of autism, and they were found to be 9 times more likely to get admitted to the hospital and 6 times more likely to have an extended length of stay. The other things, when I was researching articles that have been done on this, I found one point that just kept coming up, which really rang true as just a pediatrician and a mom, that, kids who are on the spectrum often tolerate the face masks and the face shields and the hand washing and the sanitizer a lot less well than kids who are not on the spectrum. It can be super hard. So that puts them at increased risk if they can't do the whole PPE thing. And then also they often require a lot of care during the day. So they might have multiple people working with them, the OT person, the speech person, the one-on-one, all these people. And a lot of those people are also then working with other kids who have special needs, who need lots of care, who may not be able to wear PPE. So there's just a whole host of increased kind of exposure risks, and then that the difficulty tolerating the personal protective stuff. And back to Dr. Gregory's point too about the hospitals. I mean, if a kid on the spectrum does have to be hospitalized, being hospitalized is hard for everybody, but that's really hard. So that's going to be really unfamiliar. So just thinking again, how can you protect your child kind of from the inside out? And vaccination, I didn't see anything that made me worry about. I found nothing that makes it seem like the vaccine is any riskier for kids with special healthcare needs.
Thank you. One question that popped out at me that I thought might be interesting to hear a response from anyone. Is there an estimate of what percentage of children need to be vaccinated before we can feel safe in maskless environments?
I can take a stab at that one. Okay. When they first did the studies over a year ago in adults with the Pfizer and then subsequently the Moderna vaccine, the real goal was to prevent hospitalizations and serious illness, and not to use the vaccine to prevent transmission. When they found out that the vaccine actually was pretty effective at preventing transmission, they all were surprised. All the infectious disease people were kind of surprised, because that's kind of unusual for a respiratory virus to respond to a systemic vaccine that you get in your arm by also keeping your nose from getting infected. And when that happened, it was great. We all really felt really optimistic last spring before Delta hit that, boy, we're going to have this whole mask requirement gone soon once there's population immunity or herd immunity, whatever term you want to use. Unfortunately, Delta kind of screwed all that up. And with Delta, even vaccinated people can transmit. They probably transmit less and for a shorter duration than people who aren't vaccinated, but they still can transmit. That's been pretty much proven. And they also can vaccinated people can also get cases, although they're much less severe than cases in the unvaccinated. And that's true in adults for sure. It's so rare that kids get vaccinated. It seems to be the pattern, but there's been not enough cases for us to know that, as far as I know, at least. So I think that the age of masking at this point, there's no end to it that I can see in the near future. perhaps if in addition to the systemic vaccines, they come up with other types of vaccines that protect your nose. And they are working on this. They're working on like a nasal spray vaccine that provides what they call mucosal immunity, where not only does the virus, if it gets into you, doesn't hurt you, but also can't even get into your nose. And if that happens, then the end game will be near. But for now, we're still waiting for that to occur.
Yeah, I've been made it my practice to wear a mask everywhere because there are children out there, and there still are going to be the under fives out there in the community, and so being aware of that to protect them as well, I think is kind of remembering that. I'm going to turn to some of these questions that are coming in from the audience, some live questions that we're getting. So I think what I'll do, I'm not going to direct them at anyone in particular, but we'll try to do a popcorn round and see what happens. So this question is, why would you recommend getting a vaccine if you've already had COVID? Wouldn't natural immunity outweigh a vaccination?
So I'll take a stab at that initially. I think that one of the things that's unclear about wild type versus vaccine conferred immunity, whether you get immunity from a virus or whether you get it from a vaccine, is the duration and sustainability of both. We know pretty clearly that natural COVID immunity wanes in about 3 to 6 months. We know pretty clearly that, at least within adults, that vaccine immunity begins to dip at around 6 months. But everybody's a little bit different. And I think it speaks to that spread concerns about both can you carry and spread COVID as opposed to what's your risk in terms of having a serious sequelae, a serious hospitalization, or a serious illness as a result of COVID. So it really does speak to the degree of protection against both issues to yourself as a vaccinated individual, as well as spread to others.
Does anybody else have any more that they would like to?
Well, I think there's been a number of studies on secondary cases in people that have already had COVID, and it does occur with some frequency. And if you look at correlates of immunity, like antibody levels, that they wane pretty quickly. And then when you get a vaccine after you've had COVID itself, after you had the real disease, it's like getting a super booster. Your response is amazing, much bigger response than if you get the vaccine when you never had COVID. And then you're supposed to get the booster on top of that, although the boost you get is not quite as good as the boost that a person who never had COVID had with their second shot, because already you were so high to begin with. So the recommendation is to get both shots still, even if you've had COVID. But that first shot really gives you a huge boost.
Super boost.
Mm-hmm.
Let's see, I'll turn to this next question. Will children who are 5 to 11 who get vaccinated against COVID-19 have the same exemption as older children from quarantine if they are a close contact at school or in the community? Dr. Pianka, do you have any thoughts on that?
I know that we meet with the school nurses regularly, monthly, and this is a whole big complicated decision, and we have made so many revisions to the algorithm of what we do and how we do things. There's definitely going to be a revision to that algorithm that we use to kind of guide the way that kids are allowed to function and go to school. I'm hopeful that kind of way of approaching this will extend to the kids who get this between the ages of 5 and 11. I can't promise anything because I know it's a huge, it's a huge group of people that make those decisions, but it does seem like it would make sense to treat the 5 to 11 the same way we've treated the 12 and older.
It does make sense. I know I'm sitting here in an elementary school, and I know that's top of mind for my husband, who's the principal, and his school nurse, who is his best friend in the last year and a half, 2 years. Dr. Gregory, here's a question about allergies. It says, my daughter is highly allergic to eggs, nuts, and sesame. She was unable to get the flu shot for years. Is she able to get the COVID-19 vaccine?
So I think Dr. Sewell touched on this a bit about the contraindications. So really the only two are, as you described, you've had a reaction to the COVID-19 vaccine previously, or or allergic to a component of the vaccine. So even if you have food allergies, you should be able to get this vaccination. And I always say too, your best resource is your pediatrician who knows your child and your family so well, or your family doc, primary care doc. And so any questions like this, I think they'd be happy to answer and be able to direct you about the safety for your child.
Yeah, that is the best, advice really is, and working as an employer during this time when someone, has a concern about exposure, I'm always call your healthcare provider, be it, that is your partner in this. So, and it's the same for this as well. Here's a question that anyone can answer. My son turns 12 after his first dose is scheduled, but before he will get his second dose. What is your recommendation for the kids on the cusp? Wait, get one of each? So it's the age question again. Dr. Ross, I see you shaking your head.
Yeah, I've had a couple questions in my office about this. I have generally advised folks to get the vaccine as soon as possible. The risk is now, and the risk is unvaccinated for the next 6 weeks till somebody turns 12 is still there. A higher dose is not inherently dangerous to somebody who is younger. What it does is more likely to produce side effects. So in terms of if you're on the cusp or turning 12 between doses, between the 21 days between your initial dose and your follow-up, I would recommend getting getting the initial dose and then getting the higher dose secondary, but always following based on your biologic age.
It is good to have that as a clear, being clear like that so that you're not wondering. So following that age guideline is good advice. Here's a question. My child recently got the flu shot. How long should we wait till getting the COVID vaccine?
I can answer that one. So there's currently no time that you need to wait between vaccines. At the very beginning, you might have heard something about waiting 2 weeks to get your COVID shot from your regular vaccinations. That was getting super complicated, and they dropped that recommendation. So again, I'm probably super conservative about things like that. Like I said, kind of let your immune system do one thing at a time. So if you really wanted to wait, 2 weeks is more than enough time to kind of give your immune system time to do one thing at a time. But there's absolutely no reason to wait.
Yeah, so for a family who's got busy schedules and work, and if they have an appointment, they can do it at the same time, and there wouldn't be.
Exactly. You can get two shots at the same time. You could get your flu with your COVID, or if it's available at your pediatrician's office, if your child is already there for something else, you could get it with regular vaccinations.
And would a child feel any more or less kind of reactions, the normal reactions to that, or it would just be the same?
Most of the time it ends up just being the same as what they would have had. The problem is that you're not really going to know, was it going to be that my arm going to be that sore if I had just gotten my tetanus, or is it that sore because I got my tetanus and my COVID? But you can always use different arms. And if you're only getting 2 things, if you're getting more than 2, we run out of arms. But yeah, most of the time kids are pretty sturdy. And my experience has been with the 12 to 17-year-olds that they do not have nearly as many side effects as us older people do. They seem to tolerate it quite well.
Here's a good question that I'm interested in hearing the answer. Why are childhood vaccines effective throughout your life, but a booster is needed every 6 or so months for COVID? That's a really good question. I have my smallpox vaccine scar on my arm that has protected me thus far. And I don't believe I've been boosted. So I would love to hear the answer.
Well, I think the statement is really not remembering about influenza, where we have to give the booster every year for a couple of reasons. You know, your immunity wanes and also it mutates. It's not unexpected that maybe over time we'll get variations in the COVID vaccine also. One of the nice things about this mRNA platform is it's not very difficult for the companies to change the mRNA sequence, the coding for the spike protein that they used to change it from the initial spike protein that was developed a year ago to a new one that covers the variants. And I wouldn't be surprised if boosters that we get in the future aren't modified in that way. And this gets into a little bit of an answer to one question people had in the past about how come we got these vaccines so quickly. Well, because this platform has been in development for over a decade. It's not like a new platform, and the companies that had developed it were actually using it more for cancer vaccines, but could quickly move it over to deal with viruses. They've been thinking about coronaviruses for a while because of previous MERS and these other viruses a decade ago. So it's really, it's science against the virus, but it's not unusual to have to give boosters, and it's not unusual for immunity to wane. That's why we get a tetanus shot every 10 years also.
Yeah. Dr. Ross, I saw you unmute yourself. I was wondering if you were going to say anything or.
Yeah, I'd add on, and Sid mentioned this in passing as well. The difference also is what you're trying to immune against. So, bacteria, and you can get a different type of antibody response versus virus. Viruses mutate, and influenza is a great example of something that we need regular yearly treatments for, yearly immunizations for.
Thank you. Here's a question for Dr. Gregory. Are you seeing any kids in the ICU that have been vaccinated against COVID?
So personally, I haven't. The most recent report I saw from the CDC, this is for adolescents, 12 to 17 years old, showed that if you are vaccinated, if you are unvaccinated, you are 10 times more likely to require a hospitalization than a vaccinated adolescent. So I personally haven't seen any, and I think that kind of data speaks for itself.
Yeah, there was some, well, it was adults, I believe, but it was in the New York Times a couple of weeks ago, kind of showing these graphs. I love graphs, just showing that and seeing that visual of the unvaccinated hospitalizations, and then they did it by vaccination. And even, even though there's tiered differences between it was just so significantly lower for the vaccinated population that it really spoke to the science.
Well, I think, again, kids and adults are different, but they're not that much different. And we can use the adult experience a little bit to predict what's going to happen with kids. And for example, vaccine safety. Well, there's been, 300 million doses of mRNA vaccine given to adults in this country with very, very rare serious complications from the vaccine. And then look at the experience of adults vaccinated versus unvaccinated. And certainly there are hospitalized people who are vaccinated, but what I read is that about half of the vaccinated adults are admitted because they have chronic underlying conditions, et cetera, and only about half of that group that gets admitted actually end up requiring oxygen. They're admitted kind of as a precaution. They may have some degree of respiratory distress, but they're mild enough that they never even require oxygen, which, again, pre-vaccination was almost unheard of.
That's a really good point.
Mm-hmm.
When the FDA panel was reviewing the vaccination for children 5 to 11, they stated not all children would need this vaccine. They indicated the vulnerable or immunocompromised should get vaccinated. How do you feel about all kids 5 to 11 being eligible?
I'll keep talking if nobody else wants to. I think
Go
that,
for it.
when the FDA reviewed this and the there were a number of very skeptical pediatric infectious disease experts that we all that are very famous among pediatricians who, for months have been saying, well, why do we bother putting all this resources into vaccinated kids because they get sick so rarely? So these skeptics were in this meeting with the public health people who had been collecting data on the 5 to 11 age range. And given the numbers that were already described somewhat by Dr. Gregory, the number of kids who've in this age range who have gotten hospitalized and very ill and have died, and given the data from the Pfizer study about how safe the vaccine was in this kid in this age range, these skeptics were convinced that yeah, it's rare for a healthy kid to get really ill from COVID, but it can happen, and we should not limit it to just the immunocompromised. We should give it to everybody. That also protects the immunocompromised.
Yeah, that's a really good point.
Mm-hmm.
For people who are mistrustful of governmental agencies like the CDC, what would be a reliable site for a layperson to obtain information about COVID vaccine safety?
I'm always a big fan of healthychildren.org, which is a AAP site, American Academy of Pediatrics. I think the AAP does a spectacular job of breaking things down in a very understandable way. There's articles on there about myocarditis. There's articles on there about vaccine effectiveness, why vaccinate, who's most at risk. Definitely recommend that as a resource.
Great. Dr. Pianka, do you have any other resources that you?
Well, and I would just say, going back to your point, ask your pediatrician too. If there's something you've read that you're worried about, if there's something you see, it's like, I don't know about that. I totally get it. Like, we don't all trust the FDA, but we are making decisions, and it's our job as pediatricians to figure out what's going on and whether that is something you need to worry about and that should change your decision, or whether that's not from a reliable source. So bring us things. If you're worried about something, if you've seen something, feel free to reach out to your pediatrician or family doc and ask, like, I saw this study. Is that a real study? Should I be worried about that? And we'll try to help you.
So don't go by Twitter. Like, that's the lesson. Don't follow a tweet about this.
No Twitter, and then stay away from Google.
Yeah, I know. Let me Google that. What are some recommended strategies to help support children, particularly those who may feel anxious before and during their shot? I did see this sweet image that somebody posted on Facebook of their child holding their hand, and the mom said that the child was saying as she was getting vaccinated, we've waited so long for this. And but they were like holding hands, like, because they were so glad that they had made it to that point. It made me very emotional to see it, because those kids are probably missing their grandparents, and knowing that they were doing something that can protect their loved ones too. It was a really beautiful image. So anyway, so how do you help a child get through their anxiety of getting a shot?
Well, first off, I think modeling is huge. I mean, if a parent is stressed out, if a parent is, very worried about, oh my gosh, you're going to get a shot, it is absolutely going to transfer to the child. So a parent, keeping it small, being there to support, but also using it as an experience of, hey, listen, you've fallen down, you've taken bigger tumbles in soccer. This is something that is a small, keep it small, and to see it as a growth experience. I'd love to hear from my other colleagues, my other pediatric colleagues, about some of their strategies.
Dr. Gregory, I was just thinking about children in the ICU, and like that would be a very anxiety producing situation for a child, and that there are strategies even in that would, this isn't as big of a deal, but help a child get through scary times.
Well, it is a little different. I mean, in the ICU, we use a lot of distraction strategies, with their iPads and their iPhones and songs and videos and things like that. So, I'm sure that would be helpful. I also think, explaining to the kids what they're doing and why they're doing it and why it's a good thing for their health and why it's a good thing for their family and for their friends might also be helpful and getting them more excited about getting the shot.
Any other anxious shot tips before I move to the next question? I know here in the Midcoast Hospital, their clinic in Brunswick, they're having volunteers, kind of be there in the community to just lend support and be like almost like a community celebration for the kids. And I signed up. I'm going to be there on Saturday. So I'm really looking forward to being there just to, kind of applaud these kids who are taking that step with their parents. This has already been touched on a bit, but how does the protection provided by the vaccine in preventing severe illness and hospitalization compare to the low rates of severe illness and hospitalization observed in children to date with no vaccine? So that has been touched on a bit, but it's a different angle.
I could share one of the statistics that worries me with kids and vaccination is that, or not getting vaccinated, is that with kids, like I think Dr. Gregory touched on this and so did Dr. Ross, but we just don't know. We don't know which kids, I mean, we can kind of say that kids who are immunocompromised or kids who are sick already from some other process may have a hard time if they get COVID, but, and you guys might be able to speak to this more than me, but I think the statistic is like 1 out of every 3 to 4 kids who requires the hospital actually requires the ICU. So you don't know which one of those kids is going to be your kid. And some of those kids are perfectly healthy kids who are running around playing soccer and doing everything. And it's not always the kids so you can't always predict who those kids are going to be. And, to me, if that's your baby, you're a little one, that's a big deal. So if you can protect them from the inside out and keep them stronger and have them not be the one in the ICU, it's worth it.
Yeah, and I'll just add to that. So that's the statistic that I've read as well for COVID pneumonia. For MIS-C, or the multi-system inflammatory syndrome, it's actually more like 60 or 70% of those kids are otherwise healthy and have no underlying conditions, and they require ICU level care. So, I think that's an important thing to know as well. And underlying conditions, when it's described for these kids, we're talking about obesity and asthma, respiratory issues, breathing problems, and things that are very common in kids anyway. And so, I think that if you have a child that has one of those conditions, it's really important to think about getting them vaccinated as well.
One of the questions kind of relates to this one. It says, do you have any concerns for post-vaccination myocarditis or pericarditis for children? So Dr. Gregory, is there any concern about that happening post-vaccination?
So there have been reports of that for sure. The risk is extremely low, and I'm happy to have someone else discuss this as well. But from what I've read, it's something like 5 in a million patients. And usually this inflammation, myocarditis, heart inflammation, is not severe and is recoverable, within a week. And if you compare that to the risk of myocarditis from a COVID infection, that risk is actually higher. It's reported higher in the literature and can be more severe. And so I think even just looking at that very specific vaccine reaction compared to what can happen if you get COVID, the risk of getting vaccinated is far less than actually having the infection.
Well, that I'm looking at our time, but go ahead, Dr.
I can
Sewell.
add, and the trials, when you have something that's that rare, 3,000 kids in the trial are not going to show a difference. But if you look at myocarditis in general, it rarely occurs in the 5 to 11-year-old age range. It's mostly in older kids, like older teenagers.
Okay.
In fact, that's who got it in the teenage population that developed myocarditis, it was mostly in the older range towards age 18, and it was also mostly males for some reason. So there's a lot of puzzles there. We can't say for sure it's not going to be an issue in this age range, but it doesn't seem like it's a likely outcome, and the risk of myocardial dysfunction after COVID itself is significant.
Yeah. Well, I could talk all night about this. I've learned a lot, and I know, but what's more important, I hope the parents who are on this forum have had some of their questions answered and their concerns alleviated, and following up on what most of you have said is, continue the conversation with your own pediatrician if you do have further questions or concerns. But I'd just love to do a little round robin of just letting you wrap up with some final thoughts that parents could leave here with some thinking, some inspiration, I guess, or some thoughts on decision making. And I'll start with you, Dr. Pianka. Do you have any closing thoughts about this?
Sure. So I hope for those of you who are able to join us that this was helpful, and we helped to explain the menu items and what the options are. And, there are some things that might feel a little bit scary about getting your child vaccinated in this setting, partly just because this is all so new and we've just been undergoing so much exhausting stress over the last 20 months. So just honoring that, taking a minute. And one of the things I've seen a lot is parents not agreeing on whether or not they should vaccinate the child. So if that's happening, feel free to phone a friend because sometimes it really helps to have a third party to help you sort through all the things that are going on. So just trust in your innate ability to make this decision, and we're here for you if you need us.
Do you mean like within the family, the parents are not agreeing? Okay.
Like one
wow.
parent
Yeah.
feels very strongly the children should be vaccinated, and the other parent feels very strongly the children should not be vaccinated. So my heart is with you if that is happening in your house, because I have seen it happen. And I think the thing that I've seen to be the most helpful is to get somebody to kind of mediate that discussion. And you're both on the same page. At the end of the day, you both want what's best for your child. A lot of times I've seen that there's a lot of fear, mistrust and fear are two of the big things. So if you can find somebody you trust and you can, maybe have that discussion with your pediatrician or another trusted person who can kind of give you a little perspective, it can help you sort out what's actually best for the family.
Thank you. Dr. Gregory, do you have any final thoughts to share with our audience?
Sure. Oh, thanks for having me. I really appreciate the opportunity to be able to come and share my experience in the ICU. But I guess I'll just say that the teenagers that I've taken care of who have been unvaccinated and who have been so sick, it's been really hard. I think sometimes for their families, it's hard for them. It's hard for us to take, to know that there's something that might have prevented, like the safety of a vaccine, or getting vaccinated to prevented their hospitalization and prevented them from getting so sick. And so I just encourage all parents to really, if there are any concerns, to please talk to their pediatricians and to get the facts so that they can make the best decision for their family.
Thank you. Yeah, I mean, I imagine when a child is in the ICU, that's probably what the scariest time for a parent, and then the financial implications of that weighing as well, and work, loss of work and wages. So that all is impacted by this. Dr. Sewell, do you have any final thoughts and words of wisdom for our audiences as they weigh these decisions for their family?
Obviously, I was a parent a long time ago, and now I'm a grandparent. And I think it's tough to be a parent now, tougher than when I was going through it, because you get bombarded with information from all sides. And the internet, I think, is a great tool. You can find out a lot of really good stuff on the internet, but you also can find out a lot of disinformation, misinformation, and really that's a lot of what's been interfering with the success of the public health people who are trying to tell us that these vaccines are okay, is the disinformation and misinformation that's out there. And it's tough. So what I hope parents can do is to sort through what they're reading and see what makes the most sense, and what sources are the most trustworthy, and then use that to help them make their choice. The fact that you're on this call probably means you're looking at the right sources. And again, if you're convinced, then if you have friends that are getting stuff from alternative sources, see if you can convince them, because the more people that are vaccinated, the more quickly we will return to some degree of normalcy, which is hopefully the long-term goal.
Yeah, I just, for people who are registered, I believe this is being recorded, so hopefully it will be shared with those who are registered. And if you felt that this was information that others in your circle should hear, definitely share the link, or let them know about it. So Dr. Ross, I'll let you share your final thoughts with our parents and other registered guests tonight.
Well, my father has a saying. He says, never go to a bald barber, and I would echo that here. When you look at rates of physician vaccination for COVID-19, it's 96+%. When you look at the rate of vaccination of pediatricians for their children, it's close to 100%. I think that, we've all demonstrated that here. I've certainly demonstrated that with my kids. This is the science here is strong. This is something that has been rigorously studied and reviewed based on solid knowledge and experience with different elements associated with coronavirus. So I want to come back to what Dr. Gregory had said. This is what we do. This is what we as pediatricians do. Talk to us. Come to us with your questions. If you have concerns, call your pediatrician, call your family practice physician. But that's our role, and we're honored to play that role as guidance for your family.
Excellent. Yeah, it's talk to the experts, and share this information that you've learned here tonight with your friends and family. If people ask questions and have concerns, we're all walking away with really good information. I learned a lot tonight. I don't have young children in my immediate family, but I have nieces and nephews who are going to be getting vaccinated, and I'm going to share some information with my family that I learned tonight. And also, all of the CAP agencies, MeCap is a sponsor. Most of us have Head Start, and while those children aren't vaccinated, they have siblings, and so it's really just we just see this circle, and we're all here to protect each other. And this is just another part of the circle that we're talking about, to get to that center where we're all supported. And so thank you all for being a part of this conversation. And I'm sure the pediatricians' offices are going to have lots of calls tomorrow as a result of this, I hope, and that would be a good problem to have. But we thank you for your time tonight, and for your sharing, and for the work that you've done throughout this pandemic. I know you've all been on the front lines of probably the most challenging time of your careers, I would think. So thank you.